Hi guys, welcome back. In today's video, as you guys already seen the heading, I will be talking about how to give an end of shift report. It's very important. I know that a lot of new nurses, they're very anxious. They don't know what to say, what not to say. It's that feeling is in everyone, and that's okay. And today I'm gonna give you a little bit of information that will help you. If you will be able to say most of this in your report, you'll be just fine. Now, I just want to remind you guys a little bit. Now, if you knew this information is very good and you can use it everywhere and it will go a long way. But if you're an experienced nurse, you're probably like, oh, that's too much information. That's all right. My background is hospital. I've worked 8 years in the hospital, and I have also worked in retirement home and long-term care. So I have a little bit of everything. And in the hospital, I did 6 years working in the resource team, meaning go all over the hospital. I did enjoy it. I loved it. I learned a lot from doing that. But I know a lot of new nurses like, no, I can't do it. I don't blame you guys. It's not easy to do. But when you get used to it, you're going to love it because you're going to know more than everybody else because you're going everywhere to learn different skills. So you're going to get different nurses, different personalities everywhere you go. Guys, be prepared. You're going to get that. Don't feel bad about it. But as long as you know that information and you give it to them, you're good. Now, you're going to go places where somebody's going to tell you, oh, I already know this. Oh, I already know that. Oh, I already know this. You don't have to waste your time. Don't tell me this. Just tell me the basics. Just tell me the most important. You're going to get that a lot. And that's okay. That's how they are. So I would suggest before giving report to any nurse, let's say you're a new nurse and you don't know that nurse that coming on board or whatever it is, just say, do you know this patient? Were you here yesterday, a few days? Do you just want me to give you the general, what's new, any updates? Or you don't know this patient at all and I need to get into every detail with you? I always do that. That's just me, because I know some nurses get really angry if you're talking. They'll say you're talking too much. You think you know it all. So I don't know, just the personalities, so many different personalities, guys. So I also was like, you know what? It's okay. You want to know? I tell you. You don't want to know? Fine with me, right, guys? So don't stress yourself over trying to give report and somebody's trying to make you feel bad. No. But just remember, if in case you having an admission coming to you, regardless of how experienced or yes, whatever, please, guys, you need to ask everything that I'm saying here. You really need to ask them every single thing that I'm saying. If you're getting a new admission coming to you and that's your first admission, please ask these questions. You will not go wrong by doing so. But if you're giving report end of shift and the nurse say, I know already, just tell me updates, just give them update. Don't fight them. That's up to them. Remember, you're leaving them with the information you think that is vital and that is useful. And if they don't want to get the rest from you, and that's okay. Anyways, I'm talking too much. Let's get into the information. But yeah, I just like to always I just see so many things out of my 8 years working. Like, I experienced so many different personalities, so many different people, so many. Someone who said they don't like it this, they don't like that, don't tell me this, don't tell me that, And I'm seeing like the person is giving you the accurate report that you need, but you have a problem receiving it, right? And that's okay. I don't fight them. I just know who I'm dealing with. So if I know you like just 5 things, I'll say 5 things to you. If I know you like everything, I'll tell you everything. But one thing, guys, that's one thing that I will agree with, like when you're saying somebody talking too much. If in case you come on shift and I'm leaving and you're coming on night shift and I'm giving you the 6 or 5 patients, whichever I'm giving you, and I'm telling you I will be back tomorrow morning, right? And I'm going to have these same patients. I don't expect you're going to say everything back to me. No. Please don't. Remember that. Don't say everything back to the person. Just say, did you have any updates overnight? Did anything happen? Any BM? Anything happen overnight that I need to know that I didn't know yesterday? It's like, no, nothing happened. Good, because you already have that report. You don't need the same thing over. So that's where I will agree certain times. But on the other hand, no. But anyway, guys, let's get into detail. How to give an end of shift report. Guys, you know me. One thing about me, I always tell you guys, I write everything. And if you're like me, you're not going to forget. Even up to today, as 8 years, when I don't know something and I get to know it, I write it in my book. Because these things will keep coming and you have an idea of what to do again. So this is how I go. So I don't want to forget. Now, let's start with number 1. What is the patient's name? First, middle, and last, and the correct spelling. You need that. So you need to repeat. If they're giving you a report over the phone, you're saying Mike, Paul, William. You spell it for them. You have the correct name, correct spelling. What is the patient date of birth? Number 2, you need that. And number 3, what is the code status? If you're new to nursing or you're going into nursing, code status is like full code, DNR advanced, DNR, like every hospital have their way of saying DNR, right? Some will say DNR, okay, I worked 2 hospitals. My old hospital, we only had full code, DNR, and specific interventions. The one that I'm working in, we have full code meaning do everything to try to save the life. DNR advanced, DNR restricted, DNR basic, DNR comfort care. So they have different, but DNR is do not resuscitate regardless of what it is, right? So, and comfort care meaning end of life, you're just making them comfortable, give them a little pain med, whatever they want. So that is it. So you need to know what is the patient code status that's coming to you. It is important, because if you don't know and that patient comes to you and let's say the patient code right in front of you and you don't know the patient is a DNR and you started resuscitating, you know that's wrong. That is totally wrong. You cannot do that. You can be sued because you did not even know the patient's code status and you started doing resuscitation. So you need to always ask the code status. Is it a full code? Is it a DNR? Is it a comfort care? Is it specific intervention? But whatever it is, you got to know. Now, number 4, any precautions, any isolation precaution. Is the patient on droplet contact? Is the patient on contact precaution? Is the patient, whatever precaution the patient is on, please make sure you know. If the patient is coming up with MRSA, with VRE, you know you're going to put that patient on the contact precaution. But you need to know where you're going to put that patient. And that precaution is important to know. Okay? And you also going to protect yourself from getting sick. Because you need to gang up, you need to put whatever you need to put, your PPEs, whatever you need to gear up with, you will have to do it when that patient arrives on the floor. Or if you're going into that patient's room, you know what you need to do before going in there, right? Next, we have, what is the patient admitting diagnosis, including their medical history? So what is the patient coming to you with? Hypertension, diabetes, whatever the patient is coming in, guys, you need to find out. You need to find out what the patient is coming in with and what is the patient history. All their history. Did they have a history of cancer? Whatever history they have, you need to know, right? You need to really know that history. Next, we have any abnormal lab findings. You need to know if there is anything abnormal. Their hemoglobin, is it low? Maybe they might need blood for the day. Whatever you need to know, guys, you need to know. If it's abnormal, please find out their creatine level. Whatever, please find out anything that's abnormal. And if it is abnormal, you pass it down and you also let the doctor know. You don't just leave it. Nope, it's abnormal. You got to let them know. Next is the patient on oxygen. Important. How many liters? Is the patient also COPD? You need to know that. So you're not going to give them 4 liters and they're sitting at 96. No. COPD patient, you don't do that, right? So you need to know if they're on oxygen, did they admit with it? Did they take it from home? How much they were taking at home? Are they COPD? So you know you have it under control too, right? So you need to know that. That's important. And you need to pass it down when you're giving that report. Next is the patient alert and oriented? Times 3. So you need to know if the patient is alert and oriented, you let the nurse know. If the patient confused, dementia, you let them know. Because some of them can have such a pleasant conversation with you, and boy, oh boy, they don't know nothing you're saying. They don't know, and you think they know, so you need to pass it on. Let the nurse know. Is they alert? Is they oriented? Dementia? Confused? Whatever it is, guys, pass it down. So the next nurse coming in, or if you're receiving that patient, you know who you're dealing with, what questions you're gonna ask, if you need to call the family to verify certain things, if they are dementia, right? Next we have, is the patient bed bound, right? Is it an assist times 1 or is it an assist times 2, guys? You need to know. Some patients, you can do them yourself, but I would advise most times, please guys, find a second help to help you move the patient, turn the patient for the safety of your back, your shoulders. A lot of injuries are happening because we try to do it by ourselves. But for now, I will always tell you guys, please find help and always do it with somebody else for safety. Is the patient independent or the patient needs supervision to go to the washroom or not? We need to know that. How do the mobility, right? What, in, out of bed, supervision, whatever it is, you need to know the mobility of the patient and pass it down, right? Next, we have their diet. Is the patient on regular texture, thickened texture, men's texture, whatever texture the patient is on, please pass it down or ask when receiving report. And also what type of diet they're on. Are you on a cardiac diet? Are they on the regular diet? Are they on a diabetic diet? Whatever diet they're on, you pass it down, right? So if the patient is diabetic, you know you cannot give them too much stuff like sugary and stuff like that, right? So you got to be careful. They're on a cardiac diet, you know. So you have to be really careful of the diet, the texture, and everything that you're giving, because some of them cannot take feeding fluids and you go give them a glass of water and they choking for you, right? So you got to know. That's very important before you start feeding a patient. You need to know their texture and you need to know what they're taking. Next, we have, I know you guys didn't think it, but it is so important in the nursing field. Every nurse will agree with me. What is their last BM? Guys, you can't forget that. Their last BM, you need to know, guys. If it's past 3 days, we can't leave them. We got to do something for them, you know. Yeah, we can't leave them. We need to know their last BM and we have to stay up to date with BM so they don't get constipated and stuff like that. So we always, please give the last BM. Find out whatever you need to do. Next we have, is the patient continent or incontinent? Continent, the patient will be able to tell you everything. Did they pee? Did they poo? If they're incontinent, they don't know. They don't know. You will have to be the one to check. Did they pee? So you will be the one checking and recording. They don't feel. Does the patient have a Foley catheter? If the patient have a Foley catheter, you let the nurse know the patient have a Foley catheter. Is the patient have an ileostomy or colostomy? Right? This is like the bag. Well, if you don't know, it's like a bag in the stomach and then they poo from there, right? So you also need to pass that information down because sometimes it can be full. If the nurse don't know, they might explode and you have to do everything all over. So you please pass that information down, right? So you need to let the nurse know about that. Next we have, good thing I wrote, there's a lot of things, guys, that like I say, Please, you don't need to give everything, but if you give everything this is a new patient, you need to give all that. Remember. So anyways, let's not deviate. Next we have, does the patient have any pressure injuries or wounds? How often do you do the dressing change? And when was it last done? Because you need to know, some of them are every 2 days, every 3 days, weekly, whatever, give the information. It was done today and the next one is due in 3 days. Simple. Next we have, is the patient diabetic? And how often do you do the blood sugar? Is it daily? Is it twice a day? Is it 3 times a day? Or is it 4 times a day? That's the max. So you need to know, you need to pass that information down so the nurse will not miss that information. Diabetic is very important. First thing in the morning, you're going to go check that blood sugar because it will drop, right? Next, we have, if the patient is on IV fluids, you got to say it, the rate of the IV fluid, and what it is. Is it normal saline? Is it Ringer's lactate? Whatever it is, you're going to say, wow, patient is running 100 mils an hour, normal saline, continuous. If it is a bolus, you have to give, and the doctor say just 2 bags or whatever, 1 bag, 500, 1,000, whatever. Patient is running bolus, whatever the doctor say, 1 bag and it's done or it's about to done, whatever. But you please pass that information down. Please pass that information down. If the patient has a PICC line or an IV, a saline lock, just say left hand, saline lock in left hand, or patient have a PICC line, right? Left hand, right? So you know where the patient is receiving, or if in case the patient have to receive, you know what the patient have, right? Next we have added to IV, and also if the patient is taking any IV antibiotics, and how often. Is it every 8 hours, every 4 hours, every 12 hours? So you pass that information. Patient is on IV antibiotics Q8 hours. So the nurse know, okay, well, I have antibiotics to give twice on my shift or once on my shift, right? And you also know, okay, she's taking antibiotics. Definitely he or she must have an infection somehow. So you will look into it while you're on your shift. You know, why is it taking this? But if you know also, you can say, oh, patient have a UTI, patient's on antibiotics. You know, whatever you know, you just pass it down quickly. That's the reason why, if the nurse is interested. Always remember, some of them are not, but don't let that stress you. You're going to get miserable people everywhere you go. But don't be the miserable nurse. Don't ever be the miserable nurse. Guys, I want one more thing. I have more stuff, but I just have to stop here. Guys, please, 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 if you're a nurse, please be the good one. Don't be miserable. I think I'll have to make an entire video on that. Don't be the miserable one. Be the nurse that's going to be the difference. Be the nurse that's going to say, okay, you know what? You don't want to go. It's okay. I got this. Be the nurse that's going to say, I got this. I'll do it. You're going to be the change. Okay? Be the good one. Now, anyway, let's not deviate. We have... next we have, when was their last pain medication, and are they on any? Because some of them not, but some of them they are on pain medication. So, and they will ask you like Q2, Q4, right? So I need to know, okay, when did you last give it? So give me an idea when the patient will call. I know that the patient will be calling for pain meds and stuff like that, and how comfortable the patient is right now, right? Or if I'm close to giving it, right? So that's important if they are on any pain meds. Next we have, does the patient require any test that day? If the patient requires any test, going for an x-ray, going for an ultrasound, anything that they need to do done, or going to the OR, anything that patient is scheduled for the day, please pass it down. Especially if that patient is going to the OR, you cannot forget. So let that nurse know, okay, paperwork needs to be done, or paperwork is already complete. So that nurse know. So you know you're getting yourself ready to get to that OR, and that patient, when they call you, the patient is going to go down. Well, I came from a really busy hospital. Not all hospitals is like that, but where I came from before, the one that I am, we were really fast on these things. You know, they'll call you, patient, we're ready for the patient, blah, blah, blah. So you need to get that patient gear up before in the morning, right? Next we have, will the patient be discharged on my shift? You need to know, because sometimes the patient is going home at 10 o'clock. You didn't pass that information to me. Family member is there waiting for me. Like, what? You know, and I found out like while there is report on the unit, and I was like, oh really? I didn't know. So I had to be rushing, forgetting about, you know, running up and no, that's gonna put the nurse really, really, really on edge, because they didn't know the patient is going. Please guys, pass it down. Do reports properly. Let them know, okay, patient is going at 10 o'clock. I have done the paperwork, or you need to do this or whatever, so the nurse know before in the morning what they're gonna set their day priorities, what to do and what not to do. So it's an easy day for them. Next one, if the patient is having any family meeting, upcoming family meeting, a lot of them need that. They need to know where they want to go, what they're gonna do from there, and you know, so we need to know any upcoming meetings that's gonna happen very soon, or did it just happen? Pass that information down if you can. Is the patient high risk for falls? Gosh damn, because some of them just leave you and you don't even know, and the patient would be standing up and boom, the patient is on the floor. No, pass it on. High risk for falls. Put the bed alarm on. Put the chair alarm on. Monitor this patient. Run when you hear the alarm. You know, you need to pass that information down so I know how I'm going to deal with this patient for the day, because I don't want them to fall. Fall is too much work, too much paperwork, and I ain't want that on my shift. So I'm running down to go see what's happening. You know, is the patient on restraints? You cannot leave if you don't tell me the patient is on restraints. I hate restraints. I'm not gonna lie, I don't like it. And honestly, I don't like it. But if the patient is on restraints, please let me know. So every 15 minutes, I'm gonna go monitor. Did you renew that order? Because it has to renew every 24 hours. So I need to find out. Do I need to do it? We know why the patient is on restraint, whatever. But you know, please pass that information down. And finally, I have a final. Finally, if the patient has an aggressive behavior, guys, don't miss that part. Because if the patient is kicking, punching, doing whatever, when a nurse comes in or any healthcare worker come in, guys, please pass it on. Let me know so I can prepare myself. I can go with a second person with me. I know how to approach that patient. Please pass it on if the patient have an aggressive behavior. Now, guys, this is just general. This is a general thing that if you're receiving report, if you have all that information down, you good. Like I said, not every nurse will want you to say everything to them because they already know that patient, and that's okay. But remember your basic, like some people tell, give me the basic. Oh no, guys, I forgot something, and that is absolutely important. How do the patient take their medication? Oh my God, how could I have not remembered that? Guys, either they take it whole with water, some of them take it whole in applesauce, and some of them take it crushed with maybe ice cream, pudding, applesauce, whatever it is. But that is vital. You gotta need that. That was supposed to be my first point, but anyways, that's fine. I still remember. So this is just the long version of the important things. But if you're going to go on a unit and you already you know the people, guys, the basic thing you need to know is the patient's name. What did the patient come with? Their code status. How did they take their medication? Their last BM. And any outstanding order that you need to know for the day. That is really like basic. If the person tells you, give me basic, you give them that and you're good to go. But if you want to give a good report, you give them that information. If you're receiving a patient, you take it and you never go wrong. It was nice chatting with you guys. Guys, I have so much to say, so much today. I'm probably going to make another video after this talking about being the good nurse. Don't be toxic. Anyways, I love you guys and I hope you guys enjoy my video. And I want to do more videos more often. Forgive me. I have family and work and everything. But if you have any topic that you guys would like me to talk about, do not hesitate to put it in the comment. I am going to talk about it. But I hope that will help any nurse that is anxious, don't know what to say, don't know what to do. But if you would follow my rubric and you would go, you're never going to go wrong. I love you guys and hope you guys tell a friend to subscribe. And thanks for the love and the support. I'll see you guys soon. Peace out.